Well, that was a perfect example of a learning healthcare system. Um, this is a controlled chaos, but I did make it up here. This is going to be a great panel. I hope my panelists are here. I don't see, there's Bray, Peter, and Peter. We have Peter squared and Bray. But just to lay the stage for this, you know, we've been doing a lot of talking about setting up research within systems of care, but really where the rubber meets the road is integrating learning into the delivery of care, both as patients who receive care, caregivers, people who control the systems in which the research is taking place, and the clinicians that actually are providing care. So this is a cooperative activity. It's not for the faint of heart, and it takes a lot of ongoing and continuous work. And our three panelists today are going to be talking about three different perspectives, both from an organizational perspective, and Peter Knox from Bellin Health. He's the Executive Vice President, Chief Learning and Innovation Officer in Green Bay, Wisconsin. In this role, he is responsible for population health strategies, physician networks, employer strategies, learning and innovation, and execution strategy. And then Peter Margolis, who you heard from yesterday, is going to talk about clinician engagement. And he's, as you know, from Cincinnati Children's. He's professor of pediatrics and director of research at the James Anderson Center for Health System Excellence at Cincinnati Children's Hospital Medical Center. Bray Patrick Lake, she is the PCORNet, on the PCORNet Executive Leadership Committee, and she actually is a member of the PCORNet Coordinating Center's Executive Leadership Committee and Director of Stakeholder Engagement of the Clinical Trials Transformation Initiative, or CITI. In 2010, Ms. Patrick Lake founded the PFO Research Foundation in response to the lack of definitive scientific information regarding the condition of patient I have a clinical background I always have trouble pronouncing this, PFO, after being a patient in an aborted clinical trial. So please join me in welcoming our panelists. Peter Margolis and Peter Knox will be speaking first. I think we'll take questions at the end unless there are clarifying questions. Is that fine for everyone? Okay, great.